Appreciate that we're able to be a person who is a mentor to me around everything governance and government affairs. Katie Fulham Harris has been with the MaineHealth system for decades. This is an open forum, so if you have questions, we'll try to answer them as we go, so please raise your hand, and that would be terrific.
Because she was going around getting everybody to sign up for their engagement, take their engagement surveys, and she really is to try to provide a context for the world that we are facing right now in healthcare, and really focus primarily on the year related to what we're experiencing in healthcare. And this visual really is, I feel like it's where, due to a situation that we've created, but in large part due to other priorities that are being pursued. Context, I'm going to talk a fair amount about the reconciliation legislation, which is going to have a pretty substantial impact on us, and then a little bit about the state and where we stand there. Next slide. World right now, trying to stay positive and stay moving. It's really easy to get mired in sort of the details and trying to think ahead. So times and conditions change so rapidly that we must keep our aim constantly focused on the future. I think we need to do that. I think that's really important. And then the art of life lies in a constant readjustment to our surroundings. And that is something we are doing every single day. Cindy's leading that for us right here in this region. Next slide, please. I think Les actually would be the first to say, he's been saying for a long time, we've finally reached the tipping point as it relates, and that shifted the balance so that we are facing that scenario in which we're at the center of what I call a tornado as it relates to state revenues leveling off, and we're seeing a shift in priorities in Washington as it relates to where they want their money to go. So then funding Medicaid in the past 6 months. So we just have this unprecedented activity that's aimed. So they are the natural place that people are going to turn to look for opportunities to fund other priorities. And then at the state level, Medicaid is a third of our state budget, which actually surprised me when I started to work on this last spring. It really was a pretty eye-opening look at our budget and where there are opportunities, and when state revenues are leveling off, there aren't a lot of places to go. You really have to look at Medicaid as well. It was actually founded by people who made a lot of money on Enron in Texas back in the day, and they have just sort of number of initiatives that are intended to change social issues. And those initiatives include healthcare, but it's just, their focus is really commercial healthcare. They identified a series of changes to the healthcare system that they believe would make a significant difference in affordability of healthcare and sustainability of commercial health insurance. Those issues that they have targeted are issues that would substantially impact health systems and hospitals. They really have put hospitals right at the middle of that bullseye and said, you are the problem, and we are going to go after you. It's one of the best campaigns I've ever seen. They have put hundreds and hundreds of millions of dollars into funding research, into funding the questions being asked are biased questions, and then therefore the data that is coming out is biased. It is very concerning, and our own, just at the local level, our own national consolidation of healthcare. And in Maine, we know that if you did not have Northern Light and Maine General and MaineHealth, you would have very limited access. It's just creating a constant chaos as it relates to how we do our work every day and trying to keep our sort of head, but it certainly creates a lot of concern and chaos as it relates to the delivery of health care every single day. And the most recent one that we're most sort of constant drumbeat as it relates to changes in policy that often don't have any teeth or aren't, or as I said, they're. Okay, next slide, please. So, the big bad bill, as I call it, big beautiful bill, reconciliation. There's a lot in that reconciliation legislation. I'm not going to go through all of the details. I think the most important points to make are that about 41,000 Mainers are expected to lose their health care coverage. Most of those are through Medicaid, and it's individuals, it's adults who are between 18 and 64, who are oftentimes working, but for whom they're sort of living they have difficult lives, I think I would say. And they have a hard time, they may have multiple jobs, they have a hard time making ends meet, and they're certainly going to have a hard time. They'll have a hard time with is not the actual work, but it's actually the compliance part and how they prove that they're working. And so, those of us on the coast know, or in Maine know, challenge for everyone, including the providers who treat them. At the same time, we are likely to lose between 4,000 and 10,000 people who are individuals who are in lower incomes and receive tax credits that help offset the cost of their insurance on the marketplace. That is a significant issue as well. So between the two populations, we're expecting about 41,000 people to lose their coverage. That's going to impact providers in several different ways. That impacts when they lose their coverage, they often lose their access to medication. So huge concerns on all those fronts. That is all due to increased charity care and some of the other changes that are coming down the pike.
48 million?
Yep. So other key, not a lot of press on the issue around student debt, but the bill also caps federal student debt at $200,000 per individual, $200,000. And the average nationally is about $264,000. In Maine, I think it's even higher. Biggest concern there, as many of you may know, we have this really cool program between MaineHealth and the Tufts School of Medicine, in which we have Maine-based students or students who are very interested in Massachusetts at Tufts as part of the regular Tufts class, and their last 3 years on the ground here in Maine, including at Lincoln Health, learning about rural medicine, learning first generation going to college, and then they're going to medical school. I mean, it's an incredible group and an incredible class. So very concerned about that provision. That is, the federal government is shifting the cost of those SNAP benefits onto the state, and it's going to be about $60 million a year impact on people who really rely on those benefits for food security. Huge concerns as a health system that are paid to food, and that will have a substantial impact on their own health. So really, there's a lot coming at us from this specific questions about reconciliation. Okay, next slide. Oh, yes.
I assume that a medical student could get a private loan.
Yeah.
This, I assume, is the federal.
That a lot of concern because interest rates are not as well regulated for the private loans, and the terms of the loans are more challenging oftentimes. Federally qualified health centers, certain rural areas, and that those, through the private loan program, they wouldn't have that, so. But yes, they don't lose that, yes.
Going back, if you want questions now,
Hospital-based providers, let me step back and say, physician services lose money if you're taking care of the entire population, and that's physician services. And most of our physician services are billed through a payment through our hospitals. And because they're billed through the hospitals, they are actually reimbursed who their patients are, and primarily focus on commercially insured patients. So, but if they're paid at the same level, they need to increase the pay for the independent practices and not reduce the pay for the hospital-based physicians. And they are promoting how we have bad policies sort of get enacted. So I do want to mention there are a few positives in reconciliation. One is a moratorium on implementation of a drop in the bucket compared to the $1.1 trillion that is being taken out of the healthcare system in the reconciliation bill. Some of the implications, the negative implications of reconciliation, and particularly for rural states. So that money has to be applied for by the state. It could be substantial for Maine, which would be helpful. So I do want, it really is her, that though she voted against the bill because of all the other impacts that it would have to healthcare providers, she was able to get this in, which is helpful. Next slide, please. So the impact of reconciliation is going to be slightly less for Maine than it is for many other states. The dark here means that it's going to have a higher level of impact. So you can see that Maine is, the impact is going to be slightly less. That's sort of a good thing. We have less distance to fall. Next slide, please. But the reason that we have less distance to fall is because we've been very conservative as a state, and we haven't used a lot of the capacity that the federal government allowed for Medicaid, for some of the Medicaid programs. And as a result of that, as well as a whole bunch of other things, but that definitely plays into the fact that our hospitals are in really tough shape in the state of Maine. So this was data that the Maine Hospital Association had compiled. They hired a third party to look at Maine versus all other states and ranked Maine on a series of sort of standard financial indicators compared to other states. And you can see here, so PPS means our larger hospitals, and CAH are critical access hospitals, which are small, like Lincoln is a critical access hospital, our rural hospitals. We are 39th in terms of our operating margins for our prospective payment hospitals. We're 46th for our operating margins. Total margins are 39th because we actually do pretty well on the investment side with our small endowments. Average age of plant, 46th in the nation. So this is out of 50 states. So we are not in great shape as we enter this period that is going to see even more pressure from a financial perspective. And I note that because we won't have as far to fall, but we also don't have as much cushion to absorb that fall either. Next slide, please. So the federal government also hasn't stopped with reconciliation. And right now there are pending rules, which are sort of standard rules that they put forth every year related to how we get paid, the amounts that we get paid for inpatient services, outpatient services, home health. They're proposing a 6.4% decrease in home health services. None of Maine's home health services are doing well. We need to rely on those home health services to take care of our patients in their homes. And so a 6.4% decrease is tremendous amount of challenge, represents a tremendous amount.
Drive those to the hospital, which is much more expensive.
Exactly. So the real issues there. The site neutral payments that I talked about, there's a proposal related to that in one of the rules. And then other types of changes that would negatively impact us. So really the message is they haven't stopped with reconciliation, and we're continuing to see other policies coming at us that are going to have an impact. At the same time, something that we're really concerned about, I mentioned that on the marketplace, a lot of the people rely, about 55,000 people rely upon tax credits in order to afford their insurance on the marketplace plans. Those tax credits, the enhanced part of those tax credits, so a big piece of the tax credits, expire at the end of this year. And we are very concerned that if they are allowed to expire, that whole marketplace in Maine, which is 65,000 people altogether, of which 55,000 rely on tax credits, that's going to collapse. And that's a whole nother sector of people. Many are self-employed, or they're early retirees, or for whatever reason, they are people who, they work for employers that don't offer health insurance, and they rely heavily upon this marketplace to provide access to affordable health coverage.
And that's 1/3 of our population.
Yes.
Right, so 10,464 people are on, which is a third, right. Lincoln County, to me, was sort of, I looked at the data, you have a heavy reliance on those marketplace. And if those tax credits expire in Maine, we're expected to see an average increase of 117%. Most people, people will not be able to afford that because it's all income adjusted as it is. So that's something that we are now, it's our top priority for Washington. And Senator Collins, Senator King have both come out strongly in support of extending those tax credits. But we know that Washington, there are so many variables at play right now. So this is something that we will be working on over the next few months. Next slide, please. Okay, so when you look at all these put together, all these things, the real issue is that the federal government is shifting burden onto the states, financial burden onto the states. They're doing it through SNAP, they're doing it through Medicaid, a whole variety of ways. The state will have to administer these work requirements, and we already have a stressed healthcare infrastructure. So the impact from a state perspective is substantial. At the same time, we also know we're the oldest state, we're the most rural state. A lot of people don't realize that. Maine has the highest percentage of its population that live in designated rural areas of any state in the nation. Vermont is second. So it's not Wyoming, it's not Montana, where from federal terms, they often, those are considered the rural states. We're actually more rural. And we have pretty low median income. We're 35th in terms of our median income. So the shift in the financial burden is going to have a substantial impact to us.
And it's actually even worse. If you look at wage income, we're in the 40s. If you look at wage income, we're in the 40s. We're bipolar. In other words, there's a lot of retired people here with income in one way or another. But the people who live here, who try to earn a living here, their wages are awful. And that's it's bipolar. Welcome to bipolar Maine.
Next slide, please, on that note. So when we look at I wanted to sort of take a step and say, all right, what is the federal government advocating for at the moment? And Dr. Oz is someone, he's a very smart man. He runs the Centers for Medicaid and Medicare Services now. Looking at some of his priorities and things that we can expect, technology as a solution is top of the list for him. And that's something that I think we can all embrace. And we also have to recognize the challenges, particularly in rural Maine, around you using, actually you lose cell service just between Falmouth and Yarmouth on 295. So broadband access is an issue. They're also looking at efforts to pay for value rather than fee for service. Les will tell you, we have been advocating for that for decades. We actually want to shift the way that healthcare gets paid so that it's more rational, and we're paying providers to keep their populations healthy and not paying them for individual services when we replace a hip or when you get a shot. So that's something that we have been working on and sort of in fits and starts for a while. This administration seems intent on continuing down that path, which is something we can all work together on as long as we are using the baseline of the current financial structure and not decreasing that baseline. We're hearing a lot about alternative approaches to medicine, less reliance on vaccines, more reliance on food as medicine. We'll have to see. I think those are all going to play out. I'm not going to comment on it at the moment, but we'll see how they play out. But the COVID shots are a really good example where they've declared that you have to be 65 or have one of a number of conditions in order to qualify for a COVID booster shot this year. Scarcity of financial resources, I can't, you've heard me, I mean, that's what I've emphasized here, and that's something that that's where I get worried in our state where we're already starting at a very low baseline of spend, and then emphasis on competition. And this notion that competition in a rural state is viable just doesn't make sense. We're seeing places like Lewiston that have 2 hospitals. They can't sustain both hospitals. You just can't have competition in rural communities. And I think I would say, as a native Mainer, but one who has lived in other places, we should be so proud of our community-based approach to healthcare. And we all work together. MaineHealth works with Northern Light. We want them to be successful, because if they're successful, then we can be successful, and we all have a role to play in keeping our communities healthy. And so that's something that I'm particularly proud of when I go to other places, Charlotte, North Carolina, where they're building towers and new hospitals all over the place. That's driving healthcare costs. I don't think anybody would disagree. That's also competition. So I'm trying to, it's hard to reconcile sort of this notion outside of the basic economic principles. So what we're planning for at MaineHealth, we know our patients are going to be impacted. They're going to be impacted related to food insecurity, and they're going to be increased numbers of uninsured patients. That's going to impact them directly. We care first for our patients. How does that impact us? Increased emergency department utilization, which our emergency departments are incredibly busy today. So that's a grave concern. Maine Medical Center starts every day with an absolutely full emergency room. So if we see increased reliance on emergency department care, which is the worst level of care for someone who doesn't need to be there, and it's the most expensive level of care, that's something we worry about. Declines in medical school applications, particularly in Maine, where lower and middle income families may decide that they can't afford to have their child go to medical school. That's, from an aspirations perspective, hugely concerning for us. And then hopefully a shift towards new payment models, value-based payments, and shifting the model in which we get paid. So our direct providers are going to see sicker patients. And then this idea of promotion of technology, that's happening anyway. And how we incorporate technology carefully into the healthcare realm is something that could be exciting and it could be game-changing, but it has to be done very thoughtfully and carefully. Next slide, please. So, open your arms to change, but don't let go of your values. That, to me, is where we're at. I gesticulate a lot. So our goal is to maintain our discussions with our local communities. We want to hear from you. We want you to hear from us about what we're experiencing. And as things change and as resources start to shrink, we may have to make some difficult decisions. So having those conversations with our communities is going to be really important. And then our goal always is putting our patients and our care team members right in the center of every single decision that we make. That will not change. That I'm confident of. So, staying true to our mission and vision and continuing to advocate for our patients. And with that, I think one more slide. That's how I feel most days. So, I would be happy to answer questions or have a dialogue or hear what your thoughts are as it relates to what is not necessarily the happiest of topics. Yes, Barbara.
How has public health become such a hard message to get across in this country?
That's above my pay grade. I honestly,
Above mine,
so-
I'm just trying to go.
yeah, no, I do think that COVID created sort of a juxtaposition in people's minds as it relates to how people responded to COVID, how government responded to COVID, varied so much, and I think that created a chink in the armor of public health. Outside of that, it seems to resonate with certain communities in a negative way, and that's a problem.
That's part of the problem.
Yeah,
Thank
so,
you.
yeah.
Trying to
Yeah.
be a little careful.
Yeah, no, I think we all, look, the science is the science, and there's a lot of gray area in the world of healthcare, and there are a lot of differing opinions, and there's a lot of data to support differing opinions, but there is science that underlies public health, and I think that's something that really should not be disputed, yeah. And I would say the fact that people no longer have a single trusted source of information from a media perspective. They're getting their information from different sources who have different perspectives. That wasn't the case in the old days. Louis?
I have one, I guess, question and one comment. The question is briefly, you've done a great job, thank you very much for that, and kind of explaining to the end here what MaineHealth is trying to do with, given the current situation, which is obviously very important. However, I'm going to quote a known philosopher, Karl Marx, not a hero of mine, I should say, but he said that the problem is not to explain the world, the problem is to change the world. That's paraphrase. So what can MaineHealth do, or other people do to try and change the situation, to change the dialogue? And that's the question. Public policy, what are you doing to tell people, and you're doing it here now, but people brought across the political situation, the consequences that you better look at to change some of these policies.
Yep.
That's the question, what are you doing? Second, it's a comment, and I think it's the financial constraints. The United States is not a poor country. We're a rich country. We have resources. Plenty of people have resources. All of us have some. Observers in the United States have been saying for centuries the contrast between private wealth and public poverty in the United States. Alexis de Tocqueville in the 1830s, probably someone way before that too, Janet Yellen, I heard her say a couple of years ago, right now, we are taxing a lower percentage of the total national wealth of this country than at any time since the 1930s. And this is a comment really to all of us. And there's a reason for that, because we as American voters, we tell our politicians, we have a few here, I think, we've told our politicians if they raise taxes, we'll fire them. And we've got to get around that dilemma somehow. We've got to find some way so that the legitimate functions of government, including public health, are paid for. And that's the comment. And the question.
Yeah. So I think from the question perspective related to what we can do, our job is to take care of our patients and to make sure that we are taking care of our care team members to take care of their patients, and to be not to have opinions, but to really just recount the facts. And I think you will see that MaineHealth, like other healthcare systems, is doing that. We're working with our delegation, and we're working in Washington. We work in Augusta a lot. We work in the city of Portland, actually, which has its own set of issues as well. But it really is about just ensuring that we are putting one foot in front of the other and making sure that people do understand what is coming, or what we anticipate to be coming based on our projections of the data, and staying true to the data. We are scientists. I mean, physicians are scientists first, and that's how we will continue to do our work.
I can talk a lot.
Really?
Around the world, in the countries, advanced countries, they spend 2/3 of their healthcare dollars for prevention and 1/3 for treatment. We do it just the other way. They live 4 years longer. They all spend wildly less money on healthcare than we do. It is stupid. If we could start rewarding good behavior, we'd get good behavior. I'll give you 2 more examples of the same thing. Now, why do we have slow pay from insurers? Well, hell, they invest the money. They want to pay just as slowly as they possibly can. You guys, when you have a credit card, you pay 22, 25% interest. They pay 0 interest. Of course they want to be slow. And then the third thing is workers' comp. I pay workers' comp. I've been in business for 50 years. I compete against people who don't. The people who don't have workers' comp, guess what happens when they get hurt? Charity care. And I pay for the charity care. We all pay for that. Pisses me off. Wouldn't you say? That's how we turned it into a question.
I think that was more of a statement than a question.
No.
But I do think the point around charity care is important. The point around how we have built a very convoluted healthcare financing system in this country is very relevant. And actually, we're at a part of the tipping point is the reliance at this point, certainly in Maine, on Medicaid and Medicare. So MaineHealth, about 70% of our revenues are Medicaid and Medicare. That's so Medicaid, as I mentioned earlier, they don't cover the cost of the care that is delivered. So the 30% of actually 25% of individuals who have commercial insurance end up bearing a significant burden. So we have created an affordability problem, in part because Medicaid and Medicare do not pay adequate rates to support the care that is delivered, particularly in rural areas where it's expensive. We all know. It's no different than education in many. Infrastructure is expensive. Yes?
Mount Carey, the choir is here, and we need to get a message out to the pews appear before everybody's, or at least everybody's mailbox and on their screen and watching television. This kind of details still down conveying the sharp message before the midterms.
So great question, and I think you will see that there is going to be an ongoing effort to ensure that the public is informed about the impacts of the changes that are coming through a variety of different routes. And with that being said, we're always happy to work with the choir or the pews to put together talking points and to help you help deliver that message. It needs to be a grassroots conversation. Coming from on high is not helpful. I think you will hear that from some of the pews who are here. So you actually have you have leaders here who are hearing this message too. So does that answer your question? There are lots of different ways to get information out, and that's one of the things that's transforming right now. It's evolving, and the way that younger generations hear information and absorb information and actually see information has changed pretty dramatically. And so that's something that that we're also looking to we're looking at different avenues with which to communicate at the same time.
Can we get a copy of that presentation?
Sure.
You've done? And
Absolutely.
just a big question building on some of the comments. How does the board of MaineHealth handle the dialogue with our elected officials, both at the state and especially?
Yeah. The question was how the board at MaineHealth handles the dialogue with our elected officials, as well as getting a copy of this.
At the federal level as
Yep.
well. I
Yep.
don't think you can endorse particular politicians, but you can certainly
No,
get
we don't.
information out that
Yep.
would allow
Yep.
people to, consider choices.
Absolutely.
And hopefully message that clearly so that they can see that the health system is complex and needs improvements along many ways, and the tax code doesn't help entirely, and it's threatening even some of the segments of the health area considerably. So we need an administration, both at the state, but especially the federal level, where you can have dialogue and have sensible negotiation going on, because there's some good things always in the multiple voices, not in this particular administration, I would say. So what does the board do to exert itself strongly to the public that choices coming up in the senatorial elections, let alone midterm, are critical?
That's a great question, and let me answer it in a couple of ways. First is actually Lewis's new member of a board advocacy committee that we have at MaineHealth. So we have an advocacy committee that is made up of individual board members from each of our local health systems, as well as the MaineHealth corporate board, I guess we'd call it. That group is engaged with their local delegations and as needed with federal. Our federal delegation, there are 4 people in Maine, and it's not difficult. I mean, we have great dialogues with them. They understand the implications, and I think their votes have suggested that multiple times. So I would say my perspective is that all healthcare is local, and so we really rely upon our local hospitals and the boards and the care team members leadership at our local hospitals to be part of the conversation with our local legislators. And we do breakfasts every year with our local delegations, in which board members are invited as well as our care team members. And we have, I think, pretty robust discussions at those breakfasts. This particular hospital has two local legislators on the board and used to have a third. So it's, Maine is, the beauty of Maine is that we all know each other, and it's easy to have those kinds of conversations. But I think it is less about exerting influence than it is about having dialogues at the local level about the impact that change will have on those local communities. So that's sort of my philosophy as it relates to that. Okay.
Okay, I have to actually thank you for all of the facts. I mean, some I've actually heard about, some I haven't. But the feeling that I have sitting here, after having seen all this, is that you are feeling as if there are all sorts of cuts and that you are feeling hurt. And what I am feeling sitting here, and all of the folks here are old, and I think that that I would be happier to hear how you are able to help us and how we all, as a whole, can focus on helping each other, not focusing on the pain that you are feeling. Because I have to say something about Miles. A friend of mine died here, and I thank you for this. And she had some care that was just fabulous.
Yep.
And what I think we all have here is a gem.
Yes.
And what I have been hearing is that you are going to come in and flatten some of the things that we have. You know what? Let's ask for something hopeful. Let's help each other. Thank you. I mean, you just...
So I very much appreciate that, and I'm sorry if you are hearing that we're going to flatten things. That is not the intent of this message. The intent of this message is that hard decisions are going to have to be made first at the state level, and then, yes, they will have to be made. If we are living in a more resource-constrained environment, there will be changes that impact our communities. And we want our communities to be part of that conversation. And so, to your point, one of the things, how can you be helpful? You can continue to have the dialogue with Cindy and with the care team here, because you do have a gem, and we want to protect that gem. So it's our goal, my goal, to make sure that you have what you need to know how to connect with Cindy, which you obviously do. We're Maine. We're about community, and we're about taking care of each other. And that, to me, is the single most important message for you to hear today. And there are going to be some tough times ahead.
Thank you for that. Something else that I have to say is funding. Now, why the hell can't we all figure out how to find some funding to help us? I mean, it's just incredible. I mean, some of it's, foreign to me. Others have, said, things about funding, this group or that. But something has got to change right now, because we're sinking here. We're sinking.
We haven't sunk yet. So
Okay.
let's keep innovating and keep thinking about how, as a community, we can do things differently to keep each other healthy. That's probably the single most important thing, is health. If we're healthy, and you will utilize far fewer services, and that's probably one of the most, making sure that people have access to food. So if our community is, a big piece of our community is losing access to its SNAP benefits, what can we do to make sure that they have access to healthy food as an alternative?
And that's the work that goes on every single day. Locally and in the region, and when I talk about the region, the coastal region, we work very closely with Midcoast, Penn and Waldo. And then as a system, how do we leverage what we need to do to support those basic needs of our population?
Yep.
And really importantly, provide access to primary care where patients can get the care and a lot of preventative care can be given in those lower cost settings that cost less to the patient and less to the whole. So we have to continue to do a better job of advocating of that, but that's what we work on every single day.
Yep. Meeting our mission of work.
I just wanted to respond to Ron's question and say that, we're really fortunate in Lincoln County that we have a state senator who's on the Appropriations Committee and a
Yes.
legislator, that's me.
It's a big deal.
Something we should try to do more of in the future.
Big deal. 2 legislators from Lincoln County on the State Appropriations Committee. Senator Collins is the chair of the Appropriations Committee in Washington. And then Cameron Rennie.
Senator Cameron Rennie.
Yep. And Holly Stover, Representative Stover, here in Lincoln. Yeah. Okay.
And then Marvin?
Okay.
So we touched on all of the changes. How do we, and again, MaineHealth Lincoln does a great job, shift that pendulum from treatment to prevention? Things like when you turn 65 and you suddenly can't have a physical anymore, you get this, can you breathe? Yes, you can breathe, goodbye. The physicians are no longer, once you reach this magical older adult age, able to treat you with prevention. It's all about, well, you can take this medicine and move on. How do we make that shift locally? We're doing great, we are collaborating, but change at a federal level, what those rules are, what the guidelines are, what the checklists are, so that they are.
I'm gonna let you take that.
Great question, Mary Ann, and I think you're talking about, so now there's a wellness visit that people over 65 can have, and I think it's been highly confusing for people that think they're coming in for a high-touch physical exam and time with their provider, and it's not in the queue for Medicare to have you have that, but you can have your wellness visit, which is a very different visit. So we have to get better at explaining what that means and making sure that people 65 and older are getting both.
Yes.
Because the physical is just as important, if not more important, than the wellness visit. But the wellness visit is an opportunity to have a check-in in between those physical exams. And hopefully we're getting you into your primary care or somebody on your primary care team to help you maintain and work on prevention and whatever your medications are. Unfortunately, as we all get older, we all end up with more medications. And work with pharmacists. That's why we have pharmacists in all of our primary care physician practices to help the patients to understand and to help the doctors to prescribe the right medications that work best together and do a lot of looking and checking for that. So it's a great point. We need to do a better job explaining what the difference is between those 2 things that you're eligible for and what the timing of those 2 things are that you're eligible for, so that you know what's happening.
Yeah. Thank you, Cindy, because I was, that makes sense. Margaret.
I think too, we need to explore locally. I think all of us in this room agree that we have an extraordinary hospital here.
Yes.
It's so community-based.
Yes.
And community staffed. I always joke that some of the
Yes.
nurses were born here in this
Yeah.
hospital. And, but Les spoke to the wealth dichotomy that we have in this community, and that speaks to philanthropy. And it's really incumbent upon us to explore how we can, ensure that people realize that to keep our unique, and I know this sounds like, but we are
Yep.
unique.
Yeah.
I swear, in this system, this hospital is unique. And how we can ensure that that remains available for our community, and that's through money. And we're lucky. We're building a wonderful new medical facility in Waldeboro. That's
Yep.
unheard of right
Yep.
now. It takes money.
Yes.
And we're going to double our infusion center, and that's glorious. You don't have to go to Portland or wherever, but it takes money.
It does.
And so all of us in this room can be messengers too about how important our local giving is to sustaining this remarkable institution that we have. And, you say it all, I say it all the time, I'm forever saying, but you don't understand how special we are, when we're in meetings with regional people. We are special here.
Yep.
So it's incumbent upon us to carry that message and, when possible, to let our pocketbooks speak for our sentiment. Many of us who came here, hospital was number one on our list. We were coming
Right.
here as retirees, we were
Right.
old.
Yep.
And I guarantee you that many of our transplants here had hospital as number one on their list of priorities. So, how can we sustain that, I guess? And there is a role each of us can play in ensuring that we continue to have our wonderful old Miles Hospital. I know something else sounds like the hospital, we have a dozen names, but it's still Miles to all of us. And it's a very, very special place with a very special leadership team.
Yes.
Let me plug in.
Yes.
You've all heard Cindy praise today, but
Yep.
she's not the only one.
No.
We've got stars.
Yes,
in
you
our
do.
ranks
Yes,
in our
you do.
hospital, and we're proud of it. There it is.
Well said. Well said. And I would just, I would add to that, the philanthropy piece is critical, so I will let Cindy sort of follow up on that with you. But I would also say that as we face these challenging times, think back to that Arnold, what I was talking about related to Arnold. Talking, as you just did, so positively about your hospital in your community to your neighbors at the grocery store makes a difference. People need to connect the dots and recognize that what they're reading in the newspaper really is connected to what they are, you're experiencing in your local hospital. And I think that, so just being positive ambassadors is really important.
I'm sorry, Katie, but I have to say, Cindy gets sick of hearing this. I'm approaching 2 decades of volunteering at our thrift store on Saturday morning. They say they're going to make a sign that says the doctor is in. I can't tell you, I'm a trustee, the number of patients who come to me to describe the amazing experience they had at our hospital,
Right.
either through care or through, I too recently lost a dear friend, her care was extraordinary,
Yeah.
or to talk about a particular nurse. I mean, we have some nurses that qualify for St. I swear they do.
Yep,
And
100%.
I hear about them every
That's
single
awesome.
Saturday. I hear about them. If I don't hear about them there, I hear about them in Hanover. So, we are aware of who our hospital folks are.
Yep.
And speaking as one, only as a volunteer, of course, as a trustee, but they know us and they tell us regularly. Or
Good.
at least they tell me regularly, and I tell them, they'll say, do you think you could tell Cindy, and don't use my name. And
Because
I
she's
do
very
tell-
scary.
and I-
Wonder Woman is scary.
And I do tell Cindy, and I don't use their name. Heck, I don't know their name. But anyway,
That's awesome.
they're very aware of what's.
That's
and
great.
Some are.
That's
Maybe
great.
more.
And I saw Representative Crafts.
Well, I just wanted to follow up that not only can we promote the work of Lincoln Hospital and MaineHealth, but also if you hear your neighbors who are unhappy with
Yes,
services.
yes.
I have reached out to Katie and to Sarah Calder
Yep.
so many times when constituents have had poor service or have been dissatisfied, and the hospital has been amazing in connecting with and making sure to problem solve what hasn't worked well. So I
That's
think
a-
sometimes in
thank
small
you.
communities, the rumor mill generates on this, like one person had this experience and
Right.
it's, whether it's social media or just neighbor to neighbor.
Yep.
One of the best things I think we can all do is say, hey, have you reached out? Have you called?
Yeah.
Have you given this feedback? Because the hospital is so receptive to changing where
100%.
they need to and improving. So I have appreciated that.
Thank you very much. I'm glad you mentioned that.
That is
Yes.
just as important
Yeah.
as all the wonderful compliments
Yep.
and care.